You said that they can be as small as a pea or as big as a watermelon. I can't imagine someone letting a fibroid get as large as a watermelon. How does that happen?
Yes, that's very disturbing, and I just feel for women when they come to my office and they've been dealing with this kind of problem for years, and the main reason is fear. They're afraid of what the answer is, what their options are. They're afraid it might be cancer. They're afraid they're going to have a hysterectomy. But then there's access to care. Some women don't have accessibility to good doctors to really get good diagnostic evaluations and treatment. And then lastly is just denial. Just saying, this is not really happening to me. So they may go to doctor, to doctor, to doctor, trying to get the answer that they really want to hear.
Wow. Now, Dr. Nicholas, after they've been removed, the fibroids, can they come back?
That's a very good question, Lonnie. And in fact, they may return back, the problem may recur, and that's why it's very, very important when you sit down with your doctor and talk about the options for treatment that you have the understanding that you may have to come back and have an additional procedure. Sometimes when they come back, they may not come back in the same way, and we may not predict that. They can come back twisting, they can come back causing infections, and sometimes they can come back wanting to expel themselves from the body through the vagina. I've had patients that have come to my office and show me what they brought in after they went to the bathroom, because sometimes fibroids can be released from the body in that way.
Wow.
I'm learning so much right now.
That's crazy. Yeah. Okay, what if you decide to keep the fibroids? Can you still have babies?
That's a very good question. And that's probably one of the reasons what keeps women away from coming to seek help about that. Yes. You can have children.
So you can?
Yes, absolutely. You can have a healthy pregnancy. You can have a normal pregnancy. You don't necessarily have to have a cesarean delivery. But it requires surveillance, it requires perhaps more frequent ultrasound evaluations, and it requires a patient understanding that they need to follow up. So you don't necessarily have to say that I can't have children because I have fibroids, but say the fibroids are so severe and so large and causing so many problems where hysterectomy is the solution. Now we have other ways that women can have children through surrogacy, because your ovaries are still intact. So there's so many options right now that we can look at to treat uterine fibroids. And if anything that I want to convey to your viewing audience, that you shouldn't be afraid, we can do something to help.
Wow, it's not a hopeless situation.
It's going to help a lot of women out there. Thank you so much, Dr. Nicholas. We appreciate your time.